talking about our cervical spine technique here. We call it a molding technique because it's very slow and smooth. There are many people that you can't be jabby with, you can't be quick with. Anybody who's older, anybody whose spine is rigid, anybody who's really got this thing going on, this is just perfect. There's another prone technique that's good also, but let's focus on this one here. So with this, we're going to be starting down at C7 or T1, and the key is you have to have it be really, really soft with your thumb. Your thumb has to come up against the side of that spinous as soft as you can get it. It cannot be jabby like this at all. You get the idea? It has to come in very padded, okay? Super padded, like this, grabbing the tissue and making it soft. If you're pokey with your thumb tip on that spinous and it's tender, people will hate it, which means they will not like what you're doing. So you have to be super soft here, and we're just gonna be squishing this thing over, okay? Just really squishing it over. It's nothing super fast, okay? I will just go through and do it, then I'll come back and explain a few things. It would look just like this. See, it's just like I'm just gonna rub her shoulders, just like that, see? But I'm gonna have my thumb there, very soft, okay? Right, Katie? This is not pokey, it's soft. Then my hand's gonna, see how my hand is vertical like this? Like this. I have to make sure I'm tilting your head perfectly laterally as this is scissoring like this. It's just a perfect relationship like this. There's nothing else. It's perfect lateral movement. The thumb is coming in as I'm cupping and bringing the head over. And I see she's a little bit of flexion, so I'm going to bring this back a little bit, and I'm going to really get underneath this muscle. Feel that? Okay, and I'm going to start to mold like this. I'm actually cupping over the ear and going slow. So it's kind of like nice and easy. 5, 4, 5, 6, C7, T1. Flip sides. Now watch, there's the soft thumb. Nice and easy. 7, 6, 5. Back to 6, 7, T1. See that? Now Katie will just verbalize. Are you feeling some things crunch?
A little bit.
She is feeling some crunching in there, okay? And I will say that probably at least half, if not 3/4, will feel some movement. And this may be the only thing you can do to get movement in this critical area. And remember now, the flexible neck meets the solid upper back, and so C7, in my opinion, is one of the top two. It's C7 and L5, okay? If I could only adjust 2 vertebrae, it would be L5 and C7. Then it would be T12, then it might be the atlas, okay? Remember now, T12 is the most common vertebra in the spine to subluxate. It blows out the back when we sit on everybody, but that's a topic for another day. So let me just go through this again. Just watch the whole thing if I were just gonna walk up. Now you can really kind of get in there and use a lot of pressure if you need to, right? But there's a comfort to it because all the contact points are so soft, okay? And then sometimes what I'm doing is this, is I'm going ba-boom. See, in say jiu-jitsu, if someone grabs you, it's hard to pull their hand off. But if you grab and go ba-bam, it's very easy to break a grip. And so sometimes here, watch my hand, okay? I'm gonna go like this. I'm gonna go push, push, like that. I'm gonna go push, 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 okay? And that allows me to get a little bit of speed, but in a very, very comfortable way, okay? So we start low and work ourselves back up and back down, back up and back down. Sometimes I might do it twice on both sides. Then I commonly will follow with an easy little stretch like this, pushing it on the shoulder and bring it back to the center, okay? It's an absolute lifesaver of a move. You'll use it all the time on people. And of course, it's usually what we do last, and then they're in position to jump up and be done with their visit for the day. So there you go.